So today we have a patient from Goa, and he is a software engineer himself, working in a software company. So let's hear from him what are his opinion, his views, his experience with treatment in Sai Holistic Dental Care. Hello, sir.
Yeah, hi, Dr.Dev. My name is, I'm actually from Goa and I work in Bangalore. I came here specifically for my cavitation surgeries, but I had a lot of procedures and there were a lot of improvements. So if you can ask me one by one, I can...
Yes, we'll make it an interview kind of thing.
Yes, make it a... because I have been having problems for almost little more than 1.5 years.
Oh.
And in that time frame I've had a lot of symptoms go away and have had a lot of procedures done. So we can start from
zero, from when you came to us.
Yes, from when we came to us. But before that I just want to mainly I have had 3 things done. Of course I researched about your clinic Sai Holistic, and I saw that mostly what you do is you do mercury removals and root canal removals and cavitations.
Yeah.
So for me, I had my root canals removed when I was in Bangalore
In
a conventional dentist, with a conventional dentist in Bangalore, and this happened throughout 2023, so now almost 1 year back. And that time a lot of my symptoms went away, and I just want to give that one point that some of the symptoms I was having was very severe chest pain. I had a complete frozen right and left shoulder, abdominal pain, I think this is called abdomen, or lower back pain, and heart palpitations, and also GI symptoms and some sleep related symptoms. So as soon as I removed my root canal teeth, and at that point of time I was not very sure about what I was doing, because I was new to this holistic concept. Yes, I was new to this. So that time I had my root canals removed and quite a few of my symptoms went away. The frozen shoulder, the lower back pain, the severe brain fog almost improved by 40% by removing my root canals. The only drawback I would say is I removed it with a conventional dentist, and as we talk I'll with my limited knowledge I'll try to explain why that is a drawback. So yeah, that is my background.
Okay, so starting from zero, so why you have come here?
Why I came here, actually coming here has been so long, because I contacted you almost 5 months back, I think 5 or 6 months back I first messaged you, and at that point of time I was just researching. It had already been quite a long time. I had initially seen on some podcast the disadvantages of having a root canal, and I started researching a little bit, and I'll maybe make the answer short. I found one of your patients who had reviewed about you, and I contacted them on Facebook, and they replied back. They were very kind. She was a lady actually from outside India, and she replied back to me, and she told me all the symptoms she was having, all the success she had after the procedure with you. And we talked for quite a bit, and then I decided that I at least know somebody who has come here. So that is the reason I kind of arrived here. But even after that I consulted you virtually, I think once, and we spoke for more than 1 hour at almost 10 o'clock in the night, and after that so that is the long and short of how I came here. But I came here first time in February of 2024.
So since you have stayed here for nearly 4-5 months. More than that.
Actually 3 months and 1 week.
3 months and 1 week.
Yeah.
Okay.
Total combined.
Yeah. So what was the initial thing you took from us? The first thing you took with us?
The first thing, so when I actually came here, I wanted to try the least invasive, technique, and from some people researching this holistic, even though I'm not a dentist and I don't have professional knowledge, but asking a lot of people online, I came to know that sometimes ozone injections work on cavitations. So again, when I came here, all my root canals were removed and they were completely healed. I just wanted to make sure that I did not have any active cavitations. So when I came here, I wanted to try ozone injections, and Dr.Dev and I had a discussion, I remember, and you told me that see, this might work but this might not work, but I am ready to try it out. And I was very happy because you said that at least you are ready to try it out. So I was very happy.
So all over India you did not get anyone who can give you ozone injection
I found
in the mouth?
I found 2 people, but they do ozone only for periodontal usage. Okay. So that is not into the hard bone. And it was very disappointing because I tried to convince them also. And one more precaution to people who are looking out for ozone doctors, you will find 2 or 3 of them, and maybe 2 or 3 of them in Delhi, but please don't go there because I will not specifically say who, but one will charge you very high, and they are not completely holistic doctors actually, to be honest. They may have good intentions, but they don't have they do implants and they do root canals, and that is not a holistic approach. After now I can confidently say that after knowing, of course I think you know this field much before, more than I have, and seen much more cases, but after reading so many cases online and talking to such people, I don't think somebody who does root canals and metal implants, that they can be said to be holistic. So,
perfectly right, yes.
Yeah, so I for that I think it's very commendable that you don't do root canals, and you don't do metal implants.
No, we are not doing root canals. We are not doing any kind of implants.
So that is.
So in cut short, so what you got from ozone injection?
Okay, so ozone, I'll just keep it as short, but the ozone was very powerful. I want to say one thing, that sometimes we come here expecting a certain symptom. Like for example, when I got the ozone injection, I thought that magically all my GI symptoms will go away. But that did not happen. Instead, something else happened. I was limping with my left leg and my knee was very bad. And as soon as the lower cavitation was injected with ozone, my leg arthritis, it completely went away. And limping was so noticeable that even my dad actually told me 2-3 times that, why are you limping? And it was a very unexpected thing because the knee is so away from the tooth socket that even I did not expect it. So ozone is something I will definitely encourage people to try out before they
go for any
surgery or something like. Or at least try it out. You have nothing to lose. And I think your knowledge on ozone is very good. Because I don't want to go into detail, but there is something. Okay, I will leave that part out. I will just say ozone is very powerful, and you guys can research on it. And
so you got the limping went off, the knee pain went off. and it still hasn't come back.
It still hasn't come back, and a lot of people told me that it will come back, but it still has not come back, and not even 1% back.
Not percent back. Yeah.
So
yes. So please tell us about cavitations. You got many cavitations done.
Yeah. So this is a very this is the main reason I came here, and now I have almost. I came here on March 9th, and now it is almost going to be more than 2.5 months.
Okay.
So I stayed for so long is because I wanted the healing to be very good. So initially when I came here in March, I think immediately you took a blood test of mine just to see whether all parameters are okay, and then we got 2 of the lower sockets, the cavitations cleaned out.
Yeah.
And it was done very well, and
they were not visible in CBCT.
Yeah, and these 2 cavitations were not visible in CBCT, and I just told the doctor one thing, that open the socket, and if there is no necrotic bone or it is not a cavitation, then I don't have any problem. But we were highly suspecting that it is a cavitational site because it was a former root canal site, and the healing also, what it happened very over a very long period of time, and it was very slow. So
because you got the root canal extracted in a conventional manner, so the healing took a long time, and it turned out to be a cavitation later on.
Yes.
Which we treated here.
Yes, and those were 2 sockets that were root canaled, and though that I got it done right at the beginning when I came here in March. And that was my first cavitation experience. I was very, I will say, anxious, a little bit nervous, but I said whatever happens. My main objective was I don't want any active cavitations, because after reading a lot about cavitations, again I am not an expert, but after reading a lot about cavitations, I decided that I want the cavitations out. And just to
how many cavitations?
In total, I did 4 cavitations. All of them were lower.
Yeah.
And
so tell us what all improved after the cavitations.
Okay, my symptoms mostly were, a lot of acid reflux, especially at night time, and also I was having brain fog, a little bit of sleep problems, and GI symptoms. My sleep problems improved a little bit. In the morning, I would feel fresh.
Yeah. Previously, you feel tired by waking up.
After 2-3 hours after waking up, quite tired. And GI symptoms, GI has been ongoing for a long time. It has improved slightly, but the acid reflux has, on the right side especially, it was only on the right side. It is gone. 90% I would say.
90% gone.
Yeah.
So acid reflux has gone. Insomnia is pretty much better.
And brain fog.
Brain fog is pretty much better. Your energy levels, you are high.
Energy levels have improved. Yes. So my symptoms are mild, but I can see the improvement.
Okay.
Yes. So the improvement was quite a lot, and I was very happy with the way the cavitations were performed, because you took out, I think, for each cavitation site almost. It's a fairly long.
It's a long process. Nearly 2 hours we take for a cavitation surgery to do.
Yeah. And after that, you place the PRF and the ozone, and that's a very holistic way of doing things. And one more point I want to add is the healing this time with a holistic dentist was very, very quick. For example, the socket that took almost 9 months to heal, it healed within 3 weeks.
3 weeks.
That's a very, very big difference. And also, I did not take any painkillers after the surgery. It was mostly homeopathic medicines. Only the first surgery, I think I took maybe 1 painkiller.
One tablet you took.
Yeah, but the rest, they were all managed with homeopathic medicines.
After your first surgery, we did other surgeries, and you never took any painkiller, no antibiotic. There was no infection, nothing like that.
No infection. And one more point I want to add is the pre and post detox that doctor does. So on that, you can elaborate a little bit.
We give vitamin C therapies with glutathione, with other vitamins, minerals. It's like a cocktail we give. So it helps in healing, we can say, the bone buildup, is good. The healing becomes very quick without the use of any allopathic medicines.
Yeah, so actually I want to talk about cavitations for a very long duration.
Yeah,
but I think cavitations we can, because before coming here I asked so many questions, that is this going to be a cavitation, is it not going to be a cavitation, and we tried ozone injections, so many things, and but in the end I think it was a very right choice. Now I don't have that doubt in my mind. I still have a cavitation on top. I will maybe come back for that at a later time. And
but the main point which I would like to emphasize is no cavitation site were visible in the CBCT scan other than I think one was visible. Other than that, there was no cavitation site which was visible in CBCT. But when we opened the site, there was a frank cavitation.
Yeah, all four of them.
All four of them were the frank cavitation. There was a lot of necrotic bone which was removed. So you have healed pretty good, and we hope you keep on healing.
Yeah, that last line is very important. But this coming here has been a very important step in, and it has given me actually a lot of I at least there was one doctor who understands. I remember when I went to my conventional doctor and I asked him that, do you do cavitation surgery? Actually, he asked me back, what is cavitation? So I am very lucky to find a holistic dentist in the same place in the same country that I am living in. So that is a very very positive thing.
But you traveled nearly 2,000 kilometers for it.
That is actually nothing. I will say that is nothing. I will do it one more time if necessary. So that is, yes, it is slightly far away, but it is completely worth it. And there are so many other little points that I can add in. You have helped in, but I think the main thing is the procedure. So I think we have spoken about that. If any other questions, then I'll answer. But
what you would like to say to the people who are going for root canals, who want to get root canal done, who want to get the metal implants done, who are not aware of these things, or if they are aware, they are not in the right hands?
I will just say, that maybe I'll say this in English and Hindi also. And metal implants. These are two things that once you research yourself, you will get to know that they are very harmful. Metal implants are quite harmful. Even though personally I never have had it, I have spoken to people who have had it, and they are quite harmful. Root canals cause me crippling problems, like very very crippling problems. It is so dangerous. It is so dangerous, and you may feel nothing till you have good immunity, but one day suddenly it will. For me, it was, for some people it's a gradual process. For me, within one day, one week actually, over 1 week I went down.
Okay.
And I can still remember the dates. So root canals and metal implants, please avoid. Cavitations is slightly hard to understand, but for that you can contact doctor and he will educate you on that. I will not educate people on cavitations, but cavitations is slightly hard to understand. So I think doctor is a good person to speak to and understand it and decide your treatment. And just one personal point I will add: when you are if you go in for cavitation surgery, don't do more than 2 sockets at one time. That is my personal opinion.
That is right. Yes.
Yeah, I just think so, because even if you have very good immunity, the healing is impacted. So I want to talk so much about cavitations, but I think we are restricted for time.
Thank you. Thank you very much.
And thanks to your staff for being around, and it's been a long time I'm here. So I waited for such a long time because I wanted the healing to be good. So, and in this process, I think I have seen 1 or 2 of your patients also come back, from a very bad place. So I have been a first-hand witness to. In fact, okay, this is another story, but maybe in the next interview. So, but thank you to your staff and also to you. Thanks a lot.
Thank you very much.